Great, thank you so much. I'm wondering if you could share the slides. I'm Rebecca Richards-Kortum. I am a biomedical engineer at Rice University in Houston, Texas. And the photo that you show here is unfortunately a room that is present in every hospital that I have visited on the African continent. We call it the equipment graveyard. And it's the place where equipment goes when it no longer functions and can't be repaired. Next. We like to say on our team that every medical device should come with a warning label that says this medical device can only save lives if it's used. And if it's in the equipment graveyard, it's really not doing anyone any good. Our team at Rice has been working in Africa since 2006 to design, deploy, and maintain different kinds of medical devices. Next slide. We started in Malawi, but we're now working in 4 countries: Malawi, Kenya, Tanzania, and Nigeria. And we are focused on saving newborn lives. Newborn conditions are the leading cause of death in low-income countries. Our team at Rice has joined with 16 other organizations to form an alliance that we call NEST. It stands for Newborn Essential Solutions and Technologies. And we are working in 67 hospitals in these 4 countries. These hospitals every year deliver over 500,000 babies, and about 115,000 of those babies are admitted to the hospital. So we are partnering with governments to deliver innovations to the newborn units and to build the education ecosystem to train clinicians and biomedical engineers to use those innovations to save lives. Next. What I'd like to tell you about today is our effort on innovation and education for biomedical engineers and biomedical engineering technicians. Next slide. We began by working with UNICEF to define what does it mean for a technology to be affordable, effective, and rugged. So we made target product profiles for newborn care products that are used in district hospitals in the neonatal unit. Next slide. And then we carried out an effort to qualify which commercially available technologies actually met those target product profiles. And we identified products on the market, next slide, that are affordable, effective, and rugged. Next. We formed a global nonprofit medical distribution company called Hatch Technologies, which provides distribution and support services to deliver and maintain these qualified technologies. Next slide. Next. And this shows actually the results of that. So we delivered over 2,400 medical devices to those 67 hospitals. And here we're showing the percent of those devices that are functional. And this includes the 2,400 devices we delivered, plus all of the other technologies that were already on those wards. Our target was for 90% of those to remain functional. We have 99% uptime with the devices that we actually delivered. And you can see we're very near the target for all of the categories of devices. We've been able to feed back information to manufacturers to fix known problems because we aggregate these problems across all these hospitals. So for example, with pulse oximeters, there's a motherboard that fails. We fed that information back to the manufacturer. They're improving the devices, and that benefits everyone. Next. We've created job aids, hands-on job aids for clinicians you see on the left and for biomedical technicians on the right. The training videos have been downloaded over 100,000 times, and we've engaged over 1,800 biomedical engineering technologists to learn how to carry out maintenance of these devices. Next. Then we've been working with universities that train biomedical engineers. We equip design studios so that students can go in and they can invent devices to address local health challenges. We've developed an invention education toolkit and network that connects faculty across 16 institutions, including several African countries. We've engaged over 6,000 biomedical engineers. Next. And These are some of the devices they've created. This is a bubble CPAP system created that's used in over 36 countries. Next slide. It's benefited over 1.5 million people, and it is available at about 1/10 the price of devices used in high income settings. Next slide. During COVID, these design studios developed all sorts of technologies that had local impact, including, I'll say, a training mannequin to help train healthcare providers who are doing cervical cancer prevention and treatment examinations. Next slide. I'm going to go ahead and skip this for time. Maybe you can just click through it.
Challenged more women to
Can you click through to the next? I just wanted to end by showcasing some of the colleagues that I work with. Teresa Makandawira is the former Dean of Engineering at the Malawi University of Business and Applied Science. June Medete is a biomedical engineer at Kenyatta University. Adras Malata is the Chancellor of Malawi University of Science and Technology. Nancy Chitera is the Vice Chancellor at Malawi University of Business and Applied Science. And Sade Ogunsola is the Vice Chancellor at the University of Lagos. And so there are a number of really dynamic women leaders who are engineers and who are clinicians that are really dedicated to making opportunities for women biomedical engineering technicians and biomedical engineers who can invent the next generation of technology, but also keep it out of the equipment graveyard. Thanks so much. I'd be happy to answer any questions.